Dr. Hushman's here. Okay. I don't know if it's just going to be the two of us, so I can try to add, ASDS and see if that works. So if they come up again, maybe they signed out, so that allowed you to come in.
How are you? Good to see you.
I'm fine.
So I'm so happy we were able to do this. Thank you everyone for joining us. I don't know, we're new at this, so we were going to try to do 3 people, and I was really hopeful that we would have ASDS with us, but I think Liz is somewhere in here, but I see all the questions. So I'd love to start. So I wanted to start off by introducing you, but I don't think you need very much of an introduction. This is Dr. Sandra Lee, a.k.a. Dr. Pimple Popper. She is based in Northern California, and as you all know, she is a board-certified dermatologist. And I'm Dr. Elizabeth Hushman. I'm a board-certified dermatologist based in Dallas, Texas. So thank you all for joining us. We really want to share with you who board-certified dermatologists are, what we do, what kind of patients we take care of. And I'm really looking forward to talking with Dr. Lee and kind of asking her how she became Dr. Pimple Popper. I really want to, I got a lot of DMs asking me how you got your name. How did you become? Who picked the name? Do you like it? Tell us the story.
I do like the name. I think initially I was worried actually about my colleagues, fellow dermatologists, that might think that I was sort of making fun of dermatology, that it was a, goofy name, but that really wasn't the intent. And I'm glad that really they've seen beyond that. They see that I'm not trying to make fun of our specialty, that actually it's kind of a play on words, that we're so much more than just pimple poppers. And it really came about by accident, but it actually turned out to be such a wonderful thing because it's very catchy. And I think it really helped this thing to grow. What happened really in a nutshell, in a really short story, is I initially, when I discovered initially that this was a thing that people really liked and they liked to watch it, and that's why it grew quickly on social media. I quickly discovered there was, on Reddit, which I didn't really know much about at that point, there was a group of people, tens of thousands of people, who shared popping videos with each other. And I decided to post my first videos there. And I just noticed that people were anonymous there. I didn't really know why. I didn't know why. I just noticed no one used their name. So I thought, okay, I got to think of a name. So I thought of Dr. Pimple Popper. So that's really where it came from.
That's how you started off. So your start wasn't on Instagram. It was on Reddit?
It was actually on Instagram, because I started an Instagram account to show a little window into my world, like all of us dermatologists, but there were not many physicians on Instagram. It was mostly travel pictures or food pictures, or maybe a little bit of makeup tutorials. And I decided to post very early on a blackhead extraction, and it got a noticeable increase in attention, something that I was like, what's going on here? So I decided to post it again, and it happened again. And it was through that I uploaded a YouTube video, and then somebody made a comment, you might want to check out Reddit. So that's when I went there, and that's how the whole flow happened. It all happened in a fairly short amount of time. I don't actually know, but I'm going to guess like a couple weeks.
Oh, wow. How long have you been Dr. Pimple Popper? When did you start?
Yeah, it started like October 2014. So That was probably 6 years ago or something, 6 years ago. Yeah, so that's really where it all began.
Now, a lot of dermatologists, plastic surgeons, a lot of our colleagues are on social media.
Yes.
How do you think as dermatologists we can use this platform to help educate our patients, help share information with colleagues, and it can be fun as well?
Yeah, that's really what you want to do too, as just advice to fellow colleagues, is really you want to, show your personality. We all have personalities, obviously, and that's what endears us, I think, what makes people interested in following you. But also we can show our knowledge of skin conditions, skin diseases. We really have the most extensive training in that. And it's just a nice way to really showcase our specialty, especially our specialty, because it's such a visual field. You need this video, you need pictures to be able to really explain things. And everybody knows what normal skin looks like. You know, we all know what it looks like when it's normal. We don't really, I wouldn't necessarily be able to identify a diseased liver, for example. And so we kind of understand that we all get it. And we also all know the feeling of having something on our skin that makes us embarrassed or self-conscious. And these are all ways that we can show our knowledge and really educate people while entertaining them as well. That's equally important if you want to grow, really. But it's just such a wonderful space to really showcase how varied really dermatology is, and the specialties. You know, people might think it's just acne and warts or psoriasis or skin cancer, but we all have different specialties within it. And that's what's really interesting. It's actually very different from dermatologist to dermatologist, what we do.
I think you raised such great points. So I think one of the main things that I love about our American Society of Derm Surgery is dermatologists are surgeons. We are dermatologic surgeons, and we see from infant to geriatric. And we do hair, we do nails, we do these skin cancer surgeries that you see with Dr. Lee. We do a lot. And so I think a lot of us in the media, we may be known for some of the cosmetic things that we do, but what's really great to highlight, as you say, is our training. Dermatologists spend, so we go to medical school, then do a residency. We have to do at least 1 year of a preliminary or internal med, 3 years of dedicated all skin diseases dermatology, and then Dr. Lee and others have done specialties where we are now most surgeons, cosmetic laser fellows, pediatric dermatology, dermatopathology. So we really are the true skin experts, and I love sharing that with the public. And so I love that you have brought this to the forefront, because you show tough surgical cases. And, you know, people thought you were, they didn't know you were a dermatologist. They may have thought you were a surgeon, is what they asked me. I said, no, 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 she is a board certified dermatologist. And you did a fellowship, is that right, with Dr. Fitzpatrick?
Yes, I did. Yes, he's a famous guy and one of the most wonderful, humble, I call him a humble cowboy. You know, he is really somebody who pushed the edges of dermatology, but is also not like, you know, doesn't have a big head about it. And I think that he's a wonderful mentor. And I would say too that it sounds like a long road, and it might sound very, you know, just overwhelming, and maybe you don't even know where to start. But I really encourage people to investigate dermatology if they're interested in it, because yes, it is a long road. I mean, I was in my early 30s. Usually we're in the late 20s, early 30s when we finish our training. But you know, this is really knowledge that a select few have, and we really are. It's just something that you really sort of treasure. You know that you're special in this way, and it's such an interesting field. You know, there's so many people that I do think are interested in it, and I would really encourage people to pursue this specialty, because it really is a wonderful specialty.
I couldn't agree more with you. I love being a dermatologist. I feel blessed every day to do what we do. We get to see and help people. I always say it's such a life-changing experience when you help give someone back their self-esteem.
Right.
It's psoriasis, whether it's acne, whether it is these large lipomas and cysts that you're helping with, rare genetic disorder. I mean, we see the whole thing. And no matter what age of the patient, hair loss, we are affecting. I always say it's not what you look like, it's how you feel about what you look like. And I feel that we really help with that and help people's, you know, how they live their lives. So that to me is incredible. So they're asking, how are your days spent? So we know when you're filming, you're doing cases, you're doing all these different things. In your normal non-Dr. Pimple Popper days in your clinic, what do you see? What kind of practice, what kind of patients? Can you share a little bit about your day-to-day?
Sure. Yeah, sure. My practice is very different right now than it was 5 years ago, certainly. I mean, honestly, before Dr. Pimple Popper began, I probably removed 10 cysts every 2 years or something, maybe, if I'm lucky.
practice was not just
No,
all.
no, I did not chase my patients to take out their blackheads or remove cysts, and now it is very pop heavy, certainly. And we get patients from all around the world, really. So that's quite amazing. And I'm very humbled by that. And honestly, you guys don't have to come and see me. There are wonderful people like Dr. Hashmi. There's so many dermatologists that are more qualified than I am, with more experience than I am, probably between where you are and where I am. And just make sure that you find a board certified dermatologist. And sometimes maybe they might not do the same a surgery because they might be more cosmetically inclined or whatnot. And you just need to find the right kind, and you can ask around, and certainly ask dermatologists that you know in your area, and they can probably direct you to the dermatologist that has a specialty in whatever you're looking for specifically.
Absolutely. So my recommendation is you can go on the ASDS website. And for those of you that don't know, that stands for the American Society of Dermatologic Surgery. You can put your zip code in. They'll give you great recommendations of who to see in your local area. And there's some wonderful colleagues that we are lucky enough to that can help you.
And I should say too, sorry, I didn't finish that question here. I wanted to make sure, because I do that sometimes. Sorry, I kind of go to one side. That's just life, right? Yeah. So, but as a busy woman, as you know, and having to juggle a lot of things, all of us have to juggle a lot of things. But having kids and having a husband and having a job and having friends, and now I've taken on other kind of things. I feel like I have 5 different jobs, full-time jobs. It can be very stressful and very demanding, but so rewarding, and such an amazing turn I've sort of made in my life, that I've been able to turn in a different direction, yet still use this knowledge that I've gained, that I know a select group of people have gained, that I feel very fortunate that I can actually use that knowledge to steer me in this direction. So it's really cool. It's, like I said, it's very rewarding, but it's also very demanding. And yeah, I think I live day by day, really, because even though I only work and see patients 2 days a week, and it's composed mainly of surgeries, popping surgeries, or cosmetic surgeries like liposuction or blepharoplasties, which are eye lift surgery or laser resurfacing, that kind of thing, or fillers and Botox, but also skin cancer surgery. So I'm a Mohs surgeon, meaning I do Mohs micrographic skin cancer surgery, which is a specific technique, pretty unique to dermatologists, but other specialties may do it as well. But it's really the best way to remove skin cancers on the head and the neck, certain skin cancers, while really preserving normal tissue so that your scar is as small as possible and you have the lowest risk of recurrence.
Someone was asking about liposuction. So the answer to that is yes. Actually, it was a dermatologist that is one of the inventors, the original inventors of liposuction. His name was Arnold Klein. And so I want to share with our audience, because someone wrote, oh, you do liposuction. And so yes, dermatologists do liposuction depending on their training and their level of expertise. And so she wrote skin cancers. Yes, we see skin cancers, and Mohs micrographic surgery is specific for that. So I'm so glad that we're able to share with everyone all the things that you do and that dermatologists do, because I love for patients to know who they're to see and kind of give them that empowerment to know who to seek out, what we actually do, and how they can, get help. Did you feel comfortable going on television? I know as physicians, we're usually kind of private. We're kind of, we're used to our routines. How did you feel about sharing your day-to-day, sharing your family, sharing your professional and your staff too? Were they open to joining? Can you share a bit about that?
Okay, so I already had done some television work, maybe, as a guest dermatologist or on news stations, with talk shows and things like that. So I had some experience in front of the camera in that way. And I was so lucky that production company approached me, and they saw my YouTube channel, my social media, and they were interested in making a show. And it was really nervous, and it was really nerve-wracking for me in the beginning to make this decision, because I thought, is this something that I can control? You know, because, you know, it's, I guess it would be labeled in some ways a reality show. And, you know, we hear about all these reality shows, people throw tables and people, you know, create like this drama. And I don't want them to create this drama. I didn't want a show that created drama around me or around my patients, certainly. And it has just been beyond my wildest dreams, really, what they do. I feel so lucky to, I feel like they make me look better than I am. You know, they really showcase dermatology, and I am so lucky that I actually get to see the aftermath of what I do, the effect that it has on our patients. And we, you know, all dermatologists, all doctors do this on a daily basis when they work, but you know, they leave your office and you may not see how they interact with their friends, or how, you know, how this changes their life in a dramatic way. And I get to actually see that. And that's really cool. And the other thing about what's so amazing about this show is that, you know, all these reality shows in general deal with so much, they really feed on people being angry with each other and creating a lot of dissent and drama. And especially in this whole current age right now, this current time, there's so much anger and just people fighting. It's really nice to be part of a show where it's actually doing the opposite. You have something that is not supposed to be there, is not maybe normal, and is jarring to people, and then you make it put things back in place, and it really kind of gives you hope for humankind in a way, and makes you happy about it. And that's what I feel so lucky to be a part of.
That you said it so eloquently. It's, you're helping change people's lives. They have been, you know, I saw an episode where I can't recall, it was years that gentleman had. I mean, you see,
usually years, yeah.
Wonder, how are they able to function and live, and, you know, they're doing the best they can. And then they come to see you, and you literally change not only their life, but their family members' lives. So it's such a positive thing. You're right. It is a reality show, but yet it's positive. It's helpful. You don't feel stressed after you've watched an episode. You feel happy.
Yeah, isn't that interesting that I say a lot of this, and popping in general is a lot like watching a scary movie or riding a roller coaster, or there's there's dissension, or there's something that's awry, and then you put it all in its place. So it's like a happy ending every time, you know, it's like resolution. So that's really nice.
I think what's really interesting to point out is you are doing your surgeries. You are treating actual patients, doing actual surgeries. And for the audience, for those of you that are non-physicians, we don't know until we cut open the skin what lies beneath.
Yes. And why are you reminding me of that? Just kidding.
I wasn't trying to stress you, but
no, I know.
Watching one of your, I was like, oh my gosh, well, we don't know the depth. We don't know how many like it can be so variable. And then I imagine you've got this whole film crew watching you, right, and you're trying to like do your thing. And I think that's amazing to show people how complex our work can be. And really, but that's also the fun part for me, is I feel like, well, I don't know, let's see. And then we find out, and sometimes they're just on top, and sometimes you have to go multiple layers in. And I saw sometimes if you're working on the scalp, they might be attached to what basically to your skull, and all sorts of different things.
Yeah, and you live and learn. I mean, I'm trying, you know, you're going in with your best intentions, and you're getting as much knowledge beforehand, before you do a surgery. And also with all the knowledge you've gained over this time, certainly over the last 6 years of me doing a lot of these more extensive and bigger cases, I've learned a lot. And I feel that you use this knowledge, and it's all really based on the knowledge you've acquired throughout your life too, in training, to be able to assess the situation and try to make the best decision as possible. And that's ultimately it. You really want to help this person. And you know, sometimes in dermatology, somebody comes in with something that you're not really sure what it is. And sometimes you have to try out things. It's a process, you know, between the knowledge that you have and what you suspect it might be, and try. Sometimes you have to try things and see what works. And it's like that in some ways with what I do here, but I obviously try to make the best decision. And certainly there are people that I turn down because I don't feel totally comfortable doing this procedure, or I don't think that I'm the right fit. You know, I don't think I'm the one that can properly treat this person the best.
Get to interview the patients before they air? What's the process if someone wants to come see you, or is a candidate to be on the show? How does that all work?
Right. I mean, I cannot imagine the heart attack I would have if I just had people walking in my door, you know, cold, and having to do this, especially when you have such extensive, elaborate cases. So I don't meet them beforehand, but I definitely get an idea of what's going on, or I hear a little bit of their backstory and try to get as much information as I can beforehand. Like sometimes I might think that somebody needs a scan or something, so I need to really try to get those things, you know, get those things beforehand and try to get as much information as we can. And a lot of things when you do surgeries, you have to do blood tests. You have, you know, they have a medical history that can affect things. So all of those things are very important. So they technically have a chart with me before I see them. You know, I've already kind of gotten some background from them, and that's really important to do. And that's, you know, that's important as a responsible doctor. That's what you have to do.
Of course. And how did your practice change? This year has been a crazy year for all of us with COVID. You're in California. Were you shut down for?
Yes, I think we were shut down completely for maybe 7, 8 weeks or so. And then when we came back, we were really making up for a lot of our skin cancers and things like that that had to be seen quickly. And certainly now, as a lot of people have been vaccinated, we have definitely opened up more. But there's still some things. We definitely do things in a more controlled way. We have patients that they're all not all sitting in the waiting room. You know, when I do Mohs surgery, we have a special waiting room that all the patients sit in, you know, and we shuttle them between rooms. But now they each have their own room and they stay there the whole time. That sort of thing. I'm sure you do the same kind of thing. We've all sort of had to, that's really what it's about. It's about, I call it the Muhammad Ali, you know, where you bob and weave when things come at you, and you just got to pivot a little bit and try to accommodate the situation, but really help your patients at the same time. And we've all been going through this, but luckily we see the light at the end of the tunnel, so it's coming.
I'm feeling positive myself. I mean, patients ask me and I say, you know, we pivoted, same story. I'm in Texas. We shut down late March, reopened in early May, but you know, we transitioned to telederm for some things, and it was a very nice way to be able to stay in touch with patients, to be able to still connect. And it was convenient. I didn't have to wear my mask. They could see me, I could see them. And so I love your analogy of the bob weave with Muhammad Ali, because it's true, we all had to do it, and we're still doing it to different levels, I think. But I would share with patients, I wouldn't be scared to go see your dermatologist. If you have a skin cancer, by all means, or you think you have a skin cancer, you're due for your skin check, don't let this hold you back. Come in, see somebody, see a we can do telederm with you and then bring you in if we need to. So I would tell patients, really don't be scared. See your doctor.
Yeah, and I actually do think that we are one of the safer places to go to if you compare, you know, to supermarkets or you know, just shopping in general or things like that. And this is something important to do. So because we, you know, we are in masks still. I don't know if you are, but many of us are. And I'm certain, you know, if a doctor, if you feel more comfortable, certainly masked up, I'm sure everybody would accommodate you if need be. But I think a lot of us are still doing things in a very cautious way. It's better to be safe than sorry.
I 100% agree with that. The state of Texas has not made it mandatory, but most of my physician colleagues and myself, we are all wearing masks. Staff is all wearing masks. We will ask you to wear your mask. It's just good to be safe, and I think we're almost there. We want to make sure we get to the other side so we can do things like this in person and, you know, have friends with our friends. The last time I saw you was in ASDS in Chicago on a beautiful rooftop during a friend's party, and I miss those times so much. And so I will be so excited when we can all be together again in person, because it's so much more fun. But I feel lucky that we're able to do this. And so I want to see if people have questions. I'm more than happy to answer.
Yes, and I have some questions here too. If you see something, yeah, float like a butterfly, sting like a bee. I saw that. That's right. I can ask you a question because I feel like I have so many questions for you now, actually. Let me see if I can ask you a question. I have some here, or if you see one, certainly. Let me see. Tell me a little bit about what your specialties are. I don't think you've told people.
So I did internal medicine first, then I did dermatology. I always knew I wanted to do derm, and I was at Georgetown. Then I went to Wright State, and I loved my training there. We had a VA, a children's hospital, private clinic. We saw everything, got to do tons of surgery. And so for people that sent me questions, medical students, residents, really use that time to hone your craft. Learn as much as you can. I know it's a lot of reading. I mean, all these books that are behind me, these are
I was noticing, yes. Those are all the books that I have. I pretty much do.
Exactly. And so, people had sent me questions, med students, is dermatology like, it's a lot of knowledge and it's a lot of great training. And I wanted to share, someone had asked me, when I was a resident, I didn't finish that long ago, but I chose not to be on social media during my residency training. And I'll be honest with you, in a way, I'm kind of happy about that because my focus was really on getting to know my co-residents, make sure they're going to be your family for life. I still am in touch with my attendings, my co-residents that I love. They're your family. And also learning as much as you can. Like after I'd come home from a case at the VA, I'd read about it. When we went to children's, use your time. I love social media. I think it's a lot of fun. I've met great colleagues from all over, but I would say during your training, that would be my number one piece of advice. If you can do it and you're that great at multitasking, I'm all for it, but I personally didn't, and I think it was helpful during that time. Were you on any platforms when you were in
Well,
training?
it was a while ago too myself. It was a while ago before, I think we had flip phones back then. There was no such thing as an iPhone. And also, I know that I would not have become Dr. Pimple Popper right out of residency. Really, this happened at a time in my life, 10 years into my private practice, that allowed these planets to align. That was a big part of how I was able to do this, how I grew my social media in this way, because I already had the confidence and knowledge backing of being in, having that experience of working and treating patients and seeing various things and figuring things out. And as a resident, I didn't have that knowledge, certainly didn't have that confidence, and there really wasn't social media. I can imagine it might be difficult in this day and age with residents because that is so much, that's just in the fabric of life, essentially. And that wasn't in my fabric. So I really didn't have I wasn't stuck on TikTok or Instagram because there was no such thing. And that probably gave me, I don't know, have you heard, is it harder for residents to maybe focus and really learn? Because there's a lot to learn in dermatology, but it's exciting and fun and great because you are like the expert and other people don't know these. There's so many conditions that other people don't even know, but it's like this language that we can speak to each other, right, amongst colleagues. But I wonder if that's something that actually they have to really forcibly limit themselves. And I'm sure there's programs that don't allow you necessarily to post as well.
I'm consuming. I think when I first finished, I knew I had an area of interest. And so what I did is I did my own sort of fellowship year. It wasn't a formal fellowship. There wasn't an ACG, like ASDS fellowship. I rotated with different mentors that I was very interested in learning from, would spend a month with each. And then I did some locums work to kind of be able to do that. And that to me was so wonderful. And I learned, I love lasers. I love cosmetic procedures. I love, love, love hair loss. And I know a lot of my colleagues don't, but I love
I'll send them to you. Yeah.
I
yes.
love hair. And
that's great. That's, again, why.
And learn that over time. When you first come out, I did everything, and I still do. I still see from, like I said, infant to geriatric. I love treating warts on kiddos. I love treating eczema. I love doing all my injectable fillers. But then you learn really what you're good at and what you're passionate about, and you can tune your practice to that. And then I love to teach. So through dermatology, and I love to travel. So for people that know me pre-COVID, I was all over, and I feel so blessed to have traveled the world meeting international colleagues, lecturing, learning, and dermatology is global. We all do things a little bit differently. So it's been an exciting field for me in that way. But I will say COVID made me rest a little bit. I think we're always so go, go, go. I was hardly ever home, and it really let me focus on kind of what other things I wanted to do. And I think in some ways it made me reflect a lot. So it's been in a way, not a good time, but a reflective time.
Yeah, you always have to, I always try to turn something into the positive. There always is something positive that comes out of every situation. So I agree with you. Always got to look at the silver lining.
Absolutely. See what other questions people are sending.
I have some here too, but I didn't know exactly what you meant, because some of them are a little bit more involved, and they're more, do you want like medical questions as well from people, right? Because there are questions such as, here, I'll give you a couple of them and see what you think. There's, what is the best treatment for melasma? From, it's Louis Marie. I know that's a loaded question too. Marie and Obid, I think it is. Dark spots, dark sunspot, what's the best way to get rid of them? What kind of cream do you guys recommend for people that have sensitive skin? That's from Sophie, Caitlin's mom. One. I don't know if I want to choose it.
Question. I think that's a great question. So for those of you tuning in, melasma, not all dark spots on the skin are melasma. That's number one. You can have something called post-inflammatory hyperpigmentation as a result of acne, as a result of other things that leave little brown marks on your face. You can have sun damage, which is called actinic photo damage. So true melasma really is a challenging thing to treat. We could have a whole like 2-hour lecture just on melasma. But when patients come in for that, number one, find yourself a great board certified dermatologist. That's my number one advice. And you're going to have an ongoing relationship with them, because unfortunately, no one can cure your melasma. We can make it better, but it has a chance, especially you're in a warm, sunny place, and so am I. If they're exposed to sun, it loves to come back. My number one piece of advice is daily sunscreen. Every single day, even when you're on a screen like this, have your sunscreen. If you can't do anything else, it really will help. That's my my pearl. There's lots of ways to treat it, but again, that's a very complex medical condition, and so you need a dermatologist to give you personalized medical advice. That's another thing I want to say. I love social media. I do. But I think one of the reasons why I got on this platform was to help educate, because I see so many people on there being skin experts, and they have these 13, 14 product regimens, and you really don't need all that. You need what's going to work for you. And I know when patients come in the door, they always ask me, well, you gave my friend X and it's so great. That may or may not work for you. And it's always great to know what's out there, but you always want to do what's best for your skin and get an expert to help you with that. That's what I would say.
Yeah, absolutely. Melasma is a very frustrating condition. We see it a lot here in our population of patients here in Southern California. And it is really, the treatment options are really dependent on your skin type and the depth of the pigment in your skin. And it's really something that requires, it's really best to have a one-on-one visit with a dermatologist.
100%. I mean, I love when patients ask questions on social media, but I think the best way is to really see someone that's going to analyze your skin. And less is more. I tell patients I don't want them to feel intimidated buy skincare, sometimes you can use products that are over the counter that are great, some things that are prescriptions, some things that are medical grade. There's a whole host of wonderful tools that we have in our little toolbox.
Yeah, and I think that the thing too with a lot of what I do on social media and what a lot of other dermatologists do is you really can help to educate people. You really explain it, and people want to know. They want to know what this product does, like what it actually does. Glycolic acid is a chemical exfoliator. You're trying to peel off maybe more pigment that's superficial on your skin, for example. And once you like know these things, that really gives people power. And that's what's, I think, is part of why people are interested in what people come back and listen to what a dermatologist may say, is because they're teaching them something. And if people can understand why something is working, they're more inclined to use it. And then if they see results with it, hopefully they do, they're actually really proud because they were part of the solution. They were part of figuring out how to do this because they learned, why something may work. And now they were part of figuring, improving their skin.
I always say to have healthy skin, healthy mind, healthy body, it just comes through. And so helping people understand and take control of their overall health and wellness, I think, is one of the best ways. Wow, we've got people from Turkey, Brazil, from all over. It's so fun. We're
I wonder what time it is over there. Is it like the morning you guys are just waking up, still in bed or anything? Because it's almost dinner time over here. And for you, it's a little later. You're like maybe an hour or two after me, huh?
Oh, we're getting all from all the different countries.
Yes. Somebody's got some time to go to bed for somebody. Yes. Let's see. Did you always know that you were going to be a dermatologist? Like, when did you decide? Was it in medical school?
So, I'm a very, very visual person, and I always knew I love medicine. My dad was a physician, and I love the fact that we get to, like I said, it sounds cliche, but it's so true. You really make a difference in people's lives and help people. So I always knew I wanted to be a physician from very early on. And then when I rotated in medical school, I loved OB, I loved infectious disease, I loved rheumatology. I think medicine in general is so interesting. Internal medicine is fascinating as well. And when I was applying, I really thought, dermatology is what I want to do. We did not have a derm program where I was. And so when I applied, there were a few programs that had both med and dermatology, and so Georgetown did. And so I am so grateful that I was able to do the field that I love, and it's visual. And for those of you that have sent messages, how did you match? Derm is very tough, but I always say, people would ask me, well, what's your backup? And I would say, I don't have a backup. I'm going to be a dermatologist. Put in your mind what you want to do. Be willing to do research, be willing to write, do rotations, get to know colleagues. I think it's absolutely possible if, like I said, you want to put in the time. Did you know you wanted to do derm straight away, or?
I was lucky in a way because I was sort of exposed to it at a younger age than maybe the average person would be exposed to, because my dad's a dermatologist. And so I really kind of grew up with big textbooks that you'd open up with skin conditions that I was fine with it because I would see it while I was eating my cereal in the morning, it like didn't really bother me. And he's retired now, but he was a fantastic dermatologist, and he really, our personalities are similar, and I think I like it so much. Probably, I knew that I would like it so much because I'm similar to the way he is. And I'm just, again, also very lucky to get a position. And, so I feel really lucky to be a dermatologist. Hannah asked, if you were not a dermatologist, what do you think what kind of career would you have pursued?
I think for me, I've always loved journalism also. Our field is a great one in the sense that we sort of we're educators. And so I feel like medical journalists or journalists in general help to educate and share news. So if I wasn't a dermatologist, I think I would be doing something like that. And I love when like the local news folks call me and we were talking about COVID arm and different things, because it is. I think you have to find what you love to do. For me, it's all about education. This is a form of education. News is an education. Being on a podium is education. So it's finding what your passion is and doing that. And I think what's so cool about dermatology is you really are able to do that in our field, which is kind of unique. What would you be if you weren't a doctor?
Well, now I'm a little embarrassed because I think my dream job would be to be a professional potato chip tester.
What?
I mean, I would love to try, like, that would be like a dream job for me, you know, just sit around trying different potato chips and letting people know what I think's gonna be a winner. But I mean,
Your go-to snack?
yeah, I don't really know what else I would want to be. I really like what I do, and again, you find your own thing within it. And I don't know, I like, you know, I just let I can't really think of I can't really think of an exact job that I would be other than this, because I feel so happy in what I'm doing, and I really was able to turn it into something that is similar to, you know, what you like as well. So I don't know. But anyways, potato chip tester. If anybody's hiring, I will do that as a side gig, no problem.
I think I would join you, except mine would be Swedish fish tester. I love Swedish fish. That's like
Oh, really? But are there different? I just had Swedish fish today. Are there different flavors? I just know there's like tropical, and then the regular, and then the little baby fish, and now they started to mix it up. You've got to think of different flavors now.
You know, the flavors. I'm still a fan of the classic red, like the old school ones. Those are my favorite ones to go to. That's like my med school snack that I always had with my coffee. And during the pandemic, I've sort of brought them out again.
Okay, so how come, somebody asked there, how come many dermatologists won't remove cysts? Gurjan did. Remove cysts in space that are small. I want to come see you. Well, I should clarify this by saying we really, there are two kinds of cysts in general that we're talking about maybe on the face. One would be an epidermoid cyst, which is the type of cyst you will oftentimes see me excise on the body. Usually that's on a hair-bearing part of the body, or a part of the skin that could potentially have, you know, grow hair. But there are also cysts that are associated with acne. People can have a more severe case of acne and get deeper under the skin kind of bumps that are cysts as well, but they're not like an epidermoid cyst. You really can't cut them out and excise them. You really want to have a dermatologist is going to prescribe medications for you. And if it is severe, you might want to consider Accutane, isotretinoin, which is really a fantastic medication that can transform skin, especially people with severe acne. One thing I like to say about acne, to really put it in perspective, is it doesn't threaten anyone's life directly. You know, no one ever has perished because of the acne that they had, but it really affects people's emotional health. And especially because it happens, usually it's the worst when you're a teenager, because the hormones are really just raging at that time. And that's usually where when we get our worst acne. And you're just trying to figure out the world you're in. You're just trying to figure out how to relate to others and even just be out in public. So it happens to people at a very sensitive time in their life. So it is something that we encourage kids who have acne to really seek out treatment, because you just don't want to get scarring that is permanent, because that is something that can really, even when you have bad acne when you're a teenager, can really affect the development of your personality and who you are and how you relate to people. And I'm sure you have stories like this as well. I'll have parents who bring their kid in the minute that kid has one little solitary blackhead or pimple, and you know it's because they themselves suffer from really bad acne when they're kids, and they don't want their kids to go through that same thing, because it can be very devastating.
I always say the earlier the better. We have so many wonderful treatments now, and so I agree. If you can come in earlier and we can prevent the scarring, That's the key part. And I think people need to know it's not that easy to treat scars. Yes, we have lasers. Yes, we've got all these tools, but the best way is prevention. So no, I agree. The sooner you come in, the more things we're able to do.
Yep. And I don't know if you have any other questions. Anybody's got any other little questions for us? I love you guys. You're all from Brazil. I love that. What time is it in Brazil, I wonder? Does anyone?
Friends, for joining us. And I just want to say thank you so much for everything you've done, you know, for our field and sharing everything that you, I mean, we love to have you as part of our, you know, like I said, I think showing people who dermatologists are, and you show a human side too. You're a real person with a family, juggling life and everything else that goes along with it, but yet you're able to help all these wonderful patients that come to see you. And I can't wait to see. So are you finished filming? Like, how does your filming schedule work? And then what do you get to do during your downtime, if you have any downtime?
Well, we are between, we're between tapings, but we're about to just rev up again and do another set of tapings. So we're in the middle of casting right now. If anybody has something interesting they'd like to submit, they can submit it to, it is popper@aberrantcreative.com. I'll try to put it somewhere like in my last post there. And yeah, so that's what we're just starting to do. So we're going to start up a whole nother set of shows. And and what else? We're working on my skincare line, SLMD Skincare, which really started as an acne system, but has really become this medically based skincare line. And we have some really big news coming up in a month or two. Very excited. So you guys should stay tuned. And I'm very proud to be in Target stores too, nationwide, which is awesome. And what else am I doing right now? Yeah, I'm just trying, just like everybody else, I'm just trying to keep my head above water.
No, I think we can all very much relate to that. It's been a busy time, but a good time too, because it sounds like you've been, you know, still able to see your patients and able to do your pivot to do all these other things, which really, I think, help our patients. And I really would encourage everyone that's tuned in to please go ahead and follow ASDS. Our ASDS is that at ASDS. And
ASDS Skin MD is the name, and that really is a great resource for board certified dermatologists. It's the American Society for Dermatologic Surgeons, and great group of dermatologists, great group of colleagues. And I'm one of many. I'm just one of all of these spectacular people.
We are so lucky. I was going to say, for those of you that don't know, we have some of the best colleagues. I always say we have nice people, fun people, very intelligent people, and that's a great resource for you to find your dermatologist locally. And there's great information on there as well, so please give them a follow. And if there's anything else, this will be recorded and you can go watch all of this if you're in Brazil or wherever else you guys are tuning in from and you couldn't stay for the whole thing. And Sandra, I hope I get to see you on another beautiful rooftop really soon somewhere.
And then we can hug each other.
Yeah,
that would be really nice.
And take some more selfies together and do all the fun things that we do. So I hope everyone has a great night. Thank you all for joining us. And someone loves your lipoma surgeries, by the way.
And I should say we're going to be doing this another month and we're switching off. Like she's tagging me.
On everyone, Dr. Lee is going to baton. She's going to be the host, and we have another board certified dermatologist. Have they shared with you? Stay tuned. Check in with ASDS, check in with Dr. Lee, and you'll see for the next month who.
I think it's Dr. Heidi Prather, I think it is, I believe.
Awesome.
Right? So yes, I'm really excited.
Out. So we're going to and nominate people. If you guys want to hear from different dermatologists or you have some topic of interest, next time is Skin Cancer Awareness Month. And so that's going to be amazing. So I hope you guys will all join. And thank you so much. Have a great night, everybody.
Yeah. Happy popping, guys. Take care. Stay safe. Thank you.
Bye.